Hi there, my name is Yasmin Roberts. I am infant feeding coordinator for maternity with an NHS Grampian. I'm going to tell you a little bit about this year's International Day of the Midwife topic, which is on a vital climate solution influenced by our greatest health challenge of our time, which is climate change, as I'm sure you know. I'm going to speak about how NHS Grampian, within maternity specifically, help with reducing this. And I'm going to focus on breastfeeding and how this helps our planet. Breastfeeding requires no packaging or shipping, creates no waste, and has a negligible water footprint. Helping mothers meet their breastfeeding goals is good for the short and long term health of babies and mothers and is great for our planet. The message shared by International Day of the Midwife is very powerful. Breastfeeding is much more than food. It is comfort and it is healing and it improves health outcomes. Mothers respond to their baby's cells, and so if a baby is unwell, the mother's milk is helping this by producing antibodies. Years later, cells found during breastfeeding prevent health issues in mother and baby. Breast milk benefits the environment as it requires no advertising, packaging, or transport and results in no waste. No energy is wasted sterilising bottles or refrigerating. Breast milk is the perfect temperature and no energy is required to heat it. Water and detergent is not usually needed for washing bottles unless you're giving your baby express milk. In addition, exclusive feeding at the breast does not create pollution from the manufacturing and disposal of bottles, teats, and tins. It is a renewable resource which produces minimal greenhouse gases and water footprint, contributing to local food and water security. Within Grampian, we are currently looking at ways we can reduce plastic in the storage of breast milk for expressing mothers. This will save waste plastic as we recognise that expressing in the early days can sometimes be an important part of initiating breastfeeding. Here in Grampian, we are doing lots behind the scenes to enhance the learning of our staff, which therefore improves the quality of care given to women and families. We are committed to ensuring that evidence based information is used to help with making an informed choice, and that following on from that, we can help with creating and supporting a sustainable plan of feeding for a family. We do this through a variety of ways of communicating, seeing women in the antenatal period and continuing the support throughout the postnatal period, sometimes seeing mothers coming back a second and third time. Face to face sessions with mothers who feel able to attend the hospital in the postnatal period, and phone calls, emails, and texts, whatever way they prefer, to discuss the information at their own leisure, which can sometimes be difficult in the midst of enjoying the newborn bubble. Also with Near Me sessions, which is like a video call, where mums and their families can seek support from the comfort of their home. This was a method of support brought in during COVID-19 and was such a hit that we continue to use it widely every day. Using electronic methods to communicate with women not only promotes calmness for the woman and her family being at home, but it also helps to reduce CO2 emissions because they're not coming in via car or bus. And so it's another fabulous way that we can contribute to preventing climate change. When required, our specialist team are asked to come in by our staff members who feel that women may need a bit more input and support. We see women and families for a variety of reasons, including babies with a tongue tie, which is significantly impacting breastfeeding and or causing pain to the mother. Following assessment, we refer to our surgeons who provide a first-class service at their weekly clinic. Babies who have lost between 8 to 12.5% of weight on day 3 and where the midwife feels that they require support to enhance the care given. Babies who have an excessive weight loss of 12.5% or more are always reviewed by the infant feeding team as well as the paediatric team to create a plan of care which helps maintain milk supply. Babies who are jaundiced and sleepy at the breast. Mothers with nipple trauma due to incorrect position and attachment. Babies who haven't fed at the breast, maybe because of expressing or maybe babies in the neonatal unit, lots of reasons. Mums with mental health disorders, which sometimes affect the ability to feed, just need a little bit extra support. Babies who've been supplemented, and mums trying to give more of her own milk and less of formula. Babies who are struggling to gain weight and who are at an increased risk. Mums who are trying to start feeding without a nipple shield, and any other sort of reason that there's an issue because of a health problem with mum or maybe one with baby. Together in NHS Grampian, we stand together to make a positive change to public health by improving breast rates, and we will also contribute to reducing climate change to ensure we are working towards a healthier planet with healthier families. Thank you for listening, and happy International Day of the Midwife.